I'd like to introduce today's guest speakers, Dr. Lillian Hung and Dr. Jim Mann. So Dr. Lillian Hung is an assistant professor and a Canada Research Chair in Senior Care at the UBC School of Nursing. Her research examines how technology and environment impact the care experiences of persons with dementia. She has expertise in patient-oriented research and knowledge translation, and she's committed to facilitating connectivity between academia and practice and working collaboratively with interprofessional practitioners to find practical solutions, say that one 10 times quickly, to address pressing problems in care settings. And with her today is Dr. Jim Mann, who has long been an invaluable leader and partner in our work here at the Alzheimer's Society of BC. And Jim recently rejoined our board of directors. Jim is a marketing and communications professional from Surrey who was diagnosed with young onset Alzheimer's disease at 58 years old. And since then, he's been on a mission to make life better for other people affected by dementia. Jim holds an honorary Doctor of Laws degree from UBC in recognition of his ongoing work countering stereotypes and building a more inclusive society for people living with dementia. And so on that note, welcome to the two of you, and I'll turn it over to you.
Thank you, Heather.
Okay, we got the, you
There
can
we
see
go.
the PowerPoint, right?
Yeah,
Excellent.
and we're on.
Right on. And I'm excited to be here, especially with Jim, a partner, a long-term partner that we do a lot of research together, and to be here with you to talk a little bit about the work that we do together and how we work with a lot of young students here at UBC and older adults and living with dementia and family partners together to find ways to improve like quality of life. So I'm going to show you the next slide. So this one show you a little bit about, it was one of the meetings that we had in the spring that you can see that we have a lot of young students and people from all different areas that we do research together. And you might probably know some of those people in the picture. And this is kind of like our regular place that we would have a whole research meeting. And our lab, Idea Lab, what we do is we connect patient and family partner, just like what Heather have said. And we also work closely with health system planners like Vancouver Coastal Health and a lot of staff that they are working in the front line in the clinical areas in long-term care or acute care, and researchers across the country. And students like from engineering, psychology, food and nutrition, a lot of nursing students as well, to try to find ways to improve patient outcomes. So these are the values that kind of guide the work that we do together when we work with students and older adults. And justice, social justice, equity, diversity, and inclusions. It's a little bit different than the traditional clinical trial type of research that we do. And I think what Jim, you would agree with me that we really try to use a relational approach. It's really important that we, when we work with older adults or students, or any industrial partners or other researchers, we really focus on how we relate to each other and co-create knowledge. And I'm going to turn it to Jim, and he can tell you a little bit about our telepresence robot project that he co-lead. Yeah.
Thank you, Lillian. This is an exciting project, and it's really a very positive project that linked families with residents and especially in times of COVID that restricted activities in and around long-term care. And so this project came at a really great time, but proved a number of things and really opened not only my eyes, but I like to think it's opening the eyes of a lot of people to show how the older adults and residents in long-term care really worked well with the, generally worked well with the telepresence robot. The robot project was, we had the robot at 4 different long-term care homes and to test actually I guess now 5 long-term care homes and where we worked with the staff champions and really got them on board to understand the benefits and the potential that the telepresence robot offered. And we did engage the students in the lab and the patient and the family partners along the way to really make it better in many ways, especially the patient and family partners providing a different perspective, perhaps, and of course the various disciplines and that came together with the students and the trainees and it was a really good example of intergenerational work and it turned out to be a fabulous project. What's the next slide? There we are. And here's an example of it.
Yeah. So this is the pet visit. Yeah. I think Yuki's his dog name. The dog's also cute.
近時我一直都係買啲玩具俾佢玩咧，咁好多時我考翻佢轉頭啦，叫佢攞邊件玩具，佢先會攞翻嚟。
So as you see, the robot came in on its own and had an excellent screen and was able to be navigated out of the room. And I used as Dr. Hung and I were finishing up another project, I did use the robot at a long-term care home. And I sat in my office here in Surrey and navigated the robot around in Richmond. And it was easy to do. I can raise the screen or lower it and turn it around, or it just is so easy to use. And what I found with the robot and the photo on the left with me on the screen and talking to a resident, the residents that I interacted with were very, very comfortable with the robot. It truly was an engaging conversation I had, and they looked at me as if I was there head to toe. And it certainly amazed me. But with another individual that I was speaking with, I mean, he and I were laughing, and he was telling me stories, and so it was really seemed to be well accepted and well used by families. And and we did work very closely with the care homes, and would engage with the staff to make them comfortable with technology. Certainly, many of the staff didn't use technology. Some of them, and others were just basically a phone and that's it. So it was a matter of making them feel comfortable. It was a matter of giving them a sense of how the robot would navigate around and understand where they might have a concern about privacy issues. I think we were able to really show them that the individuals, it was like the individual was there. So privacy issues were not necessarily the stumbling block that some might have thought. And our research has shown that it did really did have an impact on reducing the loneliness and isolation that is really so prevalent really in long-term care. And with families distributed around the globe now more than ever, it really did bring those family connections much closer together. It gave some caregivers that relief that they were still able to visit the resident, even though they may not be able to make it in that particular day, or because of illness on their end. But the research continues, and what we learned too was the ongoing need for the education of staff. It was very helpful, and but the one thing, and I think actually the issue around the accessibility and the stability of Wi-Fi was actually highlighted in the earlier reports from the federal government, or through the federal government funding, that many homes did not have Wi-Fi, and that is really restrictive to whether it be this project or any other use of wireless technology.
So here's a story, and
Yeah.
let me play it and see what it says.
Yeah.
Hi, Grandpa.
Hi, honey.
We ran a grandpa's cake.
We brought cake, birthday cake.
Say, lo. We're together in different places.
Yes.
That's what we say.
With that slide that showed the family from the Sunshine Coast and Dubai and Japan, I mean, that really would be such a relief for all of them to be connected and to feel to be connected to their father.
Thank you, Jim. There are really so many heartwarming stories that over the 3 years' time that we have sent these robots to long-term care homes.
Yeah.
And we have published a few papers, and it was just not enough rooms and space for us to tell all of the stories, like lots of really interesting stories and very heartwarming, like the wedding, then there's so many. Yeah. And I'm going to switch topic to talk a little bit about the other projects. So here is the virtual reality. So we have been working with Vancouver Coastal Health, and this is a MyTech funded project to look at, is it possible to have those like VR headset, virtual reality headset in long-term care for the residents, especially those older residents with dementia? Are they able to use it? Would they be willing to put on the headsets? So I'm going to show you a little video that it's in the program, that in one of the care home that we put the headset on one of the residents, and she is watching a virtual reality videos in Africa that she was with the animals.
You didn't have to do it again.
Did it feel like it come right to your face?
Yes. I'm still in here, and he's trying to decide whether he's coming after me or not.
Was it scary?
No.
No. Yeah. It's just fun, isn't it?
It is, and if you know what you're not going to do.
Yeah.
Right? So it's when. That's a little close.
It's a little close.
That's a little close. Definitely a little close.
Oh, what's this?
It's a little bear cub.
It's a bear cub, and then there's this.
Sorry.
That's okay. And then there's this huge, big
Yeah.
guy coming. How come you guys keep coming? Why are you guys? I think I better go home. But you know something? It's really interesting that they have a sense of some of us are better. Or like we don't fight with them, or we aren't afraid of them. And that's what makes the difference.
Okay.
And so I get to see them closer than most people do.
And you feel safe?
Yes, I feel safe. Because I'm not doing anything to them that tells them that I'm going to do anything to them.
Okay.
We're going to take a detour into Africa.
You can see that the residents have a lot of fun when they're able to go into the virtual world to see the animals, and it does feel very real that when the animal comes close to him, some of the animals come so close to the camera, it looks like that they're really close, like trying to kiss them in the residents in the face. So that's why she said, "Oh, this is a little too close." And some of the like the bear cubs, they're pretty cute, yeah. So we really, in this virtual reality project, we work with 2 care homes in Vancouver Coastal Health, and we use this headset, and we work with the staff in recreations and nursing department to help the residents to see that they would like to enjoy the program. The program has a variety of features, and what I have shown you is the programs about like traveling to different places of the world to see animals, and there are also underwater and adventures, like you can fly in the air balloon, you can go ski. Or maybe I'll show you the next one. I think the other one is, this one is a ski.
Okay, we're going down a pretty steep hill, you guys. Yeah, and there's some other skiers. You see the other skiers going down the hill?
Here they go.
Here we go.
There they go.
Ooh, look at
Listen
that
to
fresh
the water.
water.
Listen to the sound.
The sound. What did you hear?
You hear the move.
The
of
move.
What's going on in the air.
Uh-huh.
And you can hear it, and at least I do, because I did some of those things earlier.
Can you feel it?
I can feel it. I can feel the cold.
You can feel the cold there.
Yes, there is cold there, because everything is cold right there.
Ooh.
And there you
What?
go.
Ooh.
We're going through some tight trees.
Yes.
Ooh.
And somebody took a little fall. Get up out of the way.
Oh, look at that guy.
Should we help
Oh.
him out? Should we help him? Nah.
I don't think he would like you to do that.
You can see that it feels really real, and she even mentioned about that she feels the coldness that going down his ski. And I want to show you just this picture here that you can see that Isabella, she's a recreation therapist. So in the care home that she's using a tablet, so she is able to provide the guidance and facilitations while the residents are using the headset together, and they're in a group activity. So they're a group of residents, they're wearing the headset, so they are doing the activities together. So sometimes we say like, oh, look at the other side, that guy had fallen, do we want to go help him? I guess togetherly they said no. They wanted to move on. And it's a lot of fun, and it feels like that feeling that to be able to safely experience these adventures, and that's really really special for some of these residents, especially when you think of like during the pandemic, and a lot of residents, they are kind of stuck in the care home. So to be able to bring the outdoor activities, and they go traveling to Rome, to all kinds of places across the world, and to go underwater, to swim, and to ski, and do all these kind of, they went air balloon and seaplane. So they were talking about their legs got kind of like soft because the landing of the balloon feels a little bit scary too, but it was all these excitement, right? So it was a lot of fun. So we have learned that yes, people in long-term care can use virtual reality. So the virtual reality is not only just for the young kids or for people out there in the community. It is possible to bring in technology. So the residents with living with dementia or the older adults with frailty are able to benefit from the technology as well. It does require that we have learned that it does require like staff to help, to facilitate, and a lot of leadership support, to allow the staff to have protected time to help the residents to use the equipment. And of course, it was not easy. And during times, and then there were times that the care home had like lockdown and struggling with staffing. So what we have find that another possibility is to have students. So what we did was Jim and I had meetings to talk to some students at UBC, and then they went over there to volunteer to help the residents to use the program when the staff were not available. So that also made it possible for the staff to use the equipment as well. Yeah. Jim, do you have anything to add about the virtual reality program?
What I have found or heard from the feedback is how it is such a benefit to the individuals participating in the VR, but it also encourages conversations more broadly, so that it does have that positive impact on the loneliness or the socialization, because they all others are talking about what they saw on VR, and interesting or giving some of the other residents that thought, oh, maybe I should try it as well. And so it really is really performing a number of different positive pieces to all the residents.
Yeah, so over 2 years of time that we have learned a lot, and there's some of the lessons learned about we find that it's really important that the resident to know the preferences of the individual residents, and also to have the opportunity to provide something that's more person-centered. So we got new funding, thank you to Alzheimer's Society, and we are our next project will be looking at co-creating these videos that will be virtually will be culturally appropriate, and we want to see how a very heartwarming story from a PhD student, Joey, that one time that she went to the care home and she used our 360 camera, and she showed a video about grandchildren of an older person, and the older person was so appreciative to see the video. It was very heartwarming to see how she reacted to the video. So I think that really, like, based on that, we really learned that, like, it's so important that it's really not hard to produce those videos, but when we are able to produce those videos, it makes it possible for the residents to see their family, like a grandchild birthday party, and like there's lots and lots of possibility to film all different kind of videos to bring it into the care home so that the residents are able to see those videos. And of course, they could see it over and over again as well. We're also thinking about like possibility if the resident, if they go out for an outing, if they go out for an ice cream trip, maybe we could, take the camera and film that and bring it back in, and so when they watch the video again, they could re-experience and have conversation about, how that trips went about, and I think that's just, there's so many possible things that we could do. Yeah. So if that's okay, I'm gonna switch topic again. This one I'm not gonna talk a little bit about too much. It's a new project, but we just started to work on it, and we do have some really good results. And this is a CIHR funded project to look at virtual care. And again, we're working with Vancouver Coastal Health to see how virtual care could support people when they are moved from the hospital to when they're being discharged to go to long-term care. Because we heard from a lot of people that that process does not always go very smooth. And some of the problem is has something to do with the long-term care do not know that person really well. And there's a lot of miscommunication. So we were wondering that how policy can play a role to support family to be a part of that transitions. So we really think about like, if family could be a part of that conversation when the person is in acute care, and they will help the acute care team. The team include like physicians, pharmacists, and nurses, and like OT and PT, like all those people. If family is part of that team, they could make a better care plan to help the person to do the transition, because it's a big transition moving from to a long-term care home. So in terms of like preparations, the family there's so much the family can offer to help the team to understand, the needs and the preferences of that person. So that's what we've been doing, and we have been doing a lot of let me show you these pictures. And this is an acute care team in VGH and Vancouver General Hospital. So our staff here, like Ian and Lily and Mona, they've been working very closely with the VGH team to do a lot of interviews with all different team members and also patients and residents, and try to understand what might be some of the barriers and what can be done to improve that transition process. Yeah. So this project is still in the early stage. I would say we are about 50%, and we have done a lot of interviews. So stay tuned. Hopefully, maybe next time we'll tell you a little bit more about the results of the study. So now I'm gonna invite Jim to probably have a conversation, and I'm gonna like kind of introduce these technology with him to you. And these are the two new robots that we have been working in the last few months. And on the left side that you see, it's Kiwi. Kiwi, it's a social robot, and it came from Japan. And on the right-hand side, that's the Eva robot. The robot has a ChatGPT, and it's deployed right now in a long-term care home, and it roams around. And I'll tell you a little bit about Eva. So Eva, it's a surface robot. So Eva, it was designed to check the environment to see if there's anything wrong with the environment. Someone has fallen, there's a water leak, and there's a clutter on the floor. Like, so then it will send a report. So instead of having the person to do the rounds, then the robot does the round. So it's programmed to check like every half an hour, go for a round and check that. And so we wanted to look at like how does a robot like work in the long-term care with the team of the staff, like what might be some of the benefits and what might be some of the risk. And here are some of the features of the robot. I mentioned about it has the camera that you can see that if someone who has fallen or if there's any environmental hazards, and it also has the facial recognitions. So the first time it see Jim and go, hey, like, how are you? Then we'll ask like Jim a few questions like what's your favorite color and where you from? Like then Jim will answer those questions, and then the robot will use the machine learning. It will remember what some of the things that the Jim told him. So based on that, so it will learn about Jim. So next time when it sees Jim again, because it has a facial recognition, it could recognize, okay, this is Jim again. It's in front of me, right? So then it will have a conversation with Jim and, oh, hey, Dr. Mann. So it will based on what the conversation last time, like if Jim told him that, you know, that I don't know, what's your favorite color, Jim?
Sure, let's go with purple.
Let's go with purple. Okay, so if Jim told Eva that the color, his favorite color is purple, then the robot will come, oh, hey, and we'll have a conversation about purple. It might be even like shining, like flashing purple colors. And it's so glad to see you. I know your favorite color is it's purple. And then we'll start to have conversation related to purple colors or some things that Jim liked about, yeah. So it could also tell jokes, you know, read stories and sing songs, and it can navigate in the dark, it can monitor the environment, and it would also know to go back to the charger. It has navigation, so it knows there's something in front of it, and it'll know how to navigate and move around in order to go to the places that it was programmed to go to. So that's Eva. So this is the other robot that we have been working on. The robots, the name of the robot is called Lavot. In Japan, they put the two words together, love, robot together. They call it Lavot. So so this is the very first time the robot's brought to North America. The first time it landed to Canada. So we're very, very excited to take the robots to different places to kind of show it around. And I'll tell you a little bit about the features. So how does it work? So the robot has, you can see it has a sensor horn. The sensor horn has a 360 camera. That means it can look at the environment, the whole environment. Inside the head, it has really advanced technology, and it's able to navigate the environment, map the environment, and also the camera is able to recognize, like, this is a person, this is an object, this is a table, this is a chair, and it's also has the facial recognition. This is Jim, this is Lillian. And it has the machine learning to adapt to the owner. And like if the robot spend more time with Jim, then the robot will always follow Jim. So when Jim's in the room with the robot will just keep going to Jim, because it's like when you have a dog and you own a dog, the dog always follow you. That's what it does. And so the robot has the eyes has 6 layers of eyes and a lot of touch sensors all over the body. So you can see it's very smooth. Like I have worked with a few social robots. This is the most advanced, like, because you can see that the way that it moves is very elegant and it's very smooth. And the robot, it's really interesting. And if it's tired, then it knows to go back to its nest to charge itself. So that means that when the battery is low, then it will go charge itself. And when it's fully charged, it only takes about 15 minutes to charge a robot. When the robot is fully charged, it will come out and then do a big stretch. It pops out and then it roams around and go around the house and look for you. And it will continue to do those things like, come do something with me, play with me, lift me up, carry me. Like, so it's kind of like a domestic pet that you have in your home. So we named the robot Kiwi and Mango here. And Kiwi, and let me see, I could read it. So Kiwi is a it's a funny robot. He falls asleep all the time. So you can see that these robots, they have different character. Each of them are different. Yeah. So sometimes Kiwi could fall asleep in the job as well, but it always, and it's very curious. Whenever we have a Zoom meeting, then it's like just want to see what's going on. And Mango is a lot more outgoing. So Kiwi is more like an introvert, and it just does its own thing. And Mango loves people. Mango always run after people. And we took Mango out to a robot cafe in VGH, and it almost escaped. It went up to the ramp and out the door and wanted to leave. And yeah, so let's see this Mango. So you can see the robots, they're very adorable. So the students love playing with the robot, and I have the robot in the lab, and then they will come in and they would just interact with the robot and have a lot of fun with them. So we have the robot since July, and we have gone to a lot of community places and just try to let people see the robots and play with the robot. So I look forward to maybe having conversation with you, and if you have any questions. But Jim, should we show them this one?
Yes.
Okay, let's maybe we'll end the presentation with this
Yes.
one.
Yeah. Yeah. Okay,
so this is a TV interview that we have this robot in a care home, Amica. Amica is a really nice place, and this person 102, and she's playing with the robot, and you will see a little bit more in here.
You're sleepy.
102-year-old Charlotte England has an audience of robots keeping her company.
I'm going to make Nanaimo bars.
Social robots, in fact. Meet Kiwi and Mango. They're at the center of a study examining whether artificial intelligence can be used to help care for older people. They're a big hit with residents here. They say the pandemic left many seniors feeling isolated.
I think one of these to help the loneliness would be great. I don't see my children that often, but I mean, I could play with him all morning.
It's fun company, kind of. You don't have to feed them, you don't have to clean them, you don't have to take them for a walk. Perfect.
The AI companions are the size of a small pet and use emotional robotic software that learns and mimics human emotion.
As soon as you come home from work, it'll run to the door to greet you. It gets really active, and it actively seeks your love. It follows you everywhere, and it goes to the home to follow all different kind of people and try to check up to see what people's doing. It's kind of like a domestic cat.
With a 360-degree camera on top, these two can recognize faces and voices, even reach up for a hug.
So it knows that Tanya is standing there and you're standing there with the camera. This robot loves camera, so it always looks at that camera.
The two have been trained to take after their lead companion, leading to different personalities and even moments of jealousy.
Oh, you're getting jealous? You want to be touched too? Yes, you do.
UBC researchers worked with the Japanese manufacturer to bring Kiwi and Mango here, and now Canada is part of an ongoing international study that also includes Hong Kong and Singapore to study human-robot interactions. Am I right?
Researchers say they'll gather and analyze the results from around the globe.
So we want to compare our data. It's kind of unique. It's a little bit different here in Canada. The Canadians are a little bit reserved in terms of having new technology like this.
They'll spend the next few months recording interactions between the residents and robots, then publish those findings to help shape the future of seniors' care. Tanya Fletcher, CBC News, West Vancouver.
So I think we're gonna end here, and so it will allow us to have a bit of time to have conversation with the audience. How about that?
I think that would be a good time to do that. Have a conversation.
Wonderful. Thanks, Lillian. So we've had a number, and Jim, for such a fascinating presentation, and really interesting to see kind of what the future might hold in terms of how robots and social robots can really supplement the care we provide in care homes and enrich the quality of life of older adults who are living with dementia. So there's a number of questions that have come in, and I've been keeping track of them. So I'll start at the top and kind of work our way through. We've got about 20 minutes before I know, Lillian, you've got to dash off to a class. So one of the first questions that came in was, what is the difference between the robot on wheels and FaceTime?
The robot on wheels, that's our double robots, and the big difference is that you don't actually need to do anything, because the family log in, and the residents in long-term care will see the family. So the family does not need to turn anything on or log in and password, nothing. So it really makes zero effort to do the connections. I think it's so easy to use and makes it possible, for a lot more people to use it.
Okay, so for families then that are, sorry, Jim, I cut you off. Go ahead.
Well, I was going to say that we hear so much and read so much about how staff is being pulled in so many different directions, and there's often a shortage of staff. To use FaceTime, to use just a phone, will often require a staff person to either initiate the call or initiate the FaceTime, or in fact, for some, to actually hold the iPad. And so this releases the staff to do other things, but allows the family to keep in touch.
Excellent, great. So I think there's a concern, there were a couple of comments around how you see the use of robots in care homes. So is the goal to kind of replace humans with a voice and that touch, or do they work alongside? What would you say to folks who are like, is it a slippery slope?
It's not a service provider. It's not a substitute for staff to have face-to-face time with residents. It is there to help facilitate families keep in touch. Now, I mean, some have raised the concern that people locally might just, I won't bother driving to see, mom or dad today. I'll just connect through the robot. But I'm not so sure that our research has found that the families themselves still want to connect, but there are certain extenuating circumstances that don't allow that. And so they, because I can think of one where the husband was in long-term care and his wife was at home, but she came down with an illness that didn't allow her to visit for quite a while, I think. And so they had that option of using the robot, which was such a relief for the man's wife.
Yeah,
and the man himself, the husband himself. So
yeah, they use the robot every day.
Yeah. So no, it's not a replacement, it's enhancement.
Right. That's a great way to phrase it, I think, Jim. Yes. Switching onto the VR headset. So someone wanted to know, is that a cartoon style, or are those actually real images that folks are seeing on the VR headset?
Real images, yeah. So they're really seeing real ice and snow and real animals, yeah. So it's real video. And when we use the 360 camera to film the video, there are also real videos. And we have done some filming about like fireworks, and then we were able to bring like the experience of watching fireworks with a lot of people on the beach, bring that experience to the residents. So when they wear the headset, they could see that there are other people in front of them and they see the fireworks, yeah. So it's real video. So it gives the person a sense of presence in the virtual world, yeah.
Okay.
They even did a 360 of riding in the Canada line.
Yeah.
Oh,
that was fun.
okay.
I had not been on SkyTrain in years because of the COVID. So it was, wow. it became so real.
Oh, that's great.
Yeah.
Okay.
It was very interesting to hear from the resident about what they want to watch, yeah. So that's why we started to kind of like film our own video, because people want to see local video, like what Jim talked about, like to go on the Canada line to see the fireworks in the summer, yeah.
Yeah, and so great that you're able to tailor it. That has a lot of potential, I think, down the road, right? In terms of that person-centeredness. And I think, Jim, you spoke to that, right? About that person-centered care and being able to tailor it really suits that application.
Yeah.
One of the questions we had was there any funding, or is there any funding to kind of make this available to a wider audience or to other care homes? So obviously you're able to use this and you're using it in a research capacity, but what about for folks who aren't involved in a research study? How might they access something like this?
Yeah, I think the next step, I don't know I am allowed to say this. I'm going to say it anyways. I think learning from the first project, and now Vancouver Coastal Health, it's planning to make the headsets available, open it to all of the long-term care sites, and they're in the planning stage, and so it would not be only limited to like 1 or 2 sites that they're involved in the research. So that is going to require a little process of planning and coordinations, but it will be open up, yeah.
Yeah, and as someone who has a background in recreation and spent many years working on the front lines, I think that's such a tremendous opportunity to take it out wider and kind of scale up that technology. Jim, you were going to say something.
Yeah, but it's also, I guess, one of the benefits of research is that you test it. It's sort of like testing a product in a market. See how it is what's the word? Accepted, and then you also see what might be a barrier for a broader implementation. And so, but research, once you've done that part, you write the papers and so on, but it gets out there, and other people learn from you. Other people learn from the experiences and learn what might be possible. And you know that at least you hope, I guess, that another care home somewhere else, whether it be Canada or wherever, might install or might try a robot or might do the VR, but they'll have the head start because they will have read about it and see what's possible, see where some of the barriers are, and try to mitigate those barriers before it even starts.
Okay. Now, one of the things, and I think you alluded to this a little bit, is around the Wi-Fi access and some of the challenges that might exist around Wi-Fi access. And I think of folks particularly who might be in the northern parts of our province, or even here in the interior, where Wi-Fi access is a little less predictable and stable than it is, say, in the lower mainland. And so, what might some of the challenges be around that in terms of the use of this technology?
Yeah. So the Wi-Fi is really a bad challenge because I say it's bad because I really see the Wi-Fi, it's a basic human right. Like people should have access. So this is a structural problem. It's not up to the individual to fix that, right? So this is a system issue. So it takes bigger societal or government to help to fix that problem. And it's not just in the interior or northern, even in the lower mainland. It's very strange that we have some of those rooms, Jim, that you can see that, they're in one room, we have really good streaming Wi-Fi, and the next door neighbor just across the, on next door, and has really poor Wi-Fi. It's really, so stable Wi-Fi is really, really important. And when you ask about what are the technology challenge, like Jim mentioned about like the ongoing IT support, that is another really important thing. But I would refer that to a system, challenge, because for the IT support, like we can't just go ask the IT person to come in to help. It needs to come from the leadership of the organization, right? So it's more of a system and policy challenge. Yeah.
It seems to me that somebody, whether was it BC government or some other province or something, had actually designated quite a large amount of money to make Wi-Fi, to install Wi-Fi throughout the province. But I may be wrong on that, but I thought I had read it. So.
Well, it's almost like becoming unacceptable to not have Wi-Fi. I personally, I wouldn't want to live in a place that this night I don't have access to Wi-Fi. The Wi-Fi access allows me to have access to a lot of things, right? So so these people living in the care home, then they deserve to have the the Wi-Fi access so that they could enjoy all these other, like, so many wonderful programs that's possible to enrich their quality of life.
Yeah.
And I think particularly when we think about the COVID-19 pandemic that we've sort of all lived through the last couple of years, and that equity piece to allow everyone that lives in care to have access to their family members, not just those who are living close by.
Yeah.
And so sort of a related question, just sort of riffing off the kind of northern interior piece and thinking about folks who might not live in a care home. What are the applications to folks who may be living with dementia, but who aren't living in care, but who are still in community? And how might you see some of these applications supporting them in the community?
Totally possible. Yeah. And we just haven't had the funding and the time to go there yet. I think maybe the future work, like for example, like the LaFont robots. And the LaFont robot can do a lot in a person's home. If the person with dementia is living alone in the home, because it's just lovely to have a little pet, that follows you. And when so the robot is connected to the phone with an app. So if the older person's get outside to go get groceries and come home, the robot knows you're coming home. So it will run to the door to greet you when it's very excited to see you coming home. And if you, because it has facial recognitions, so it will recognize you. And if Jim is living alone by himself, and who knows that this is my owner, this is Jim. So if someone else went into Jim's home, then the robot knows this is not Jim. So the robot will take a picture and send it to Jim, like, Jim, you got an invader in your house, right? So almost serve as a house monitor. And so there's lots of things that these robots can be helpful in the community, not just in a care setting.
Okay, and I want to squeeze. Go ahead, Jim.
But but if if having it in a person's home becomes price prohibitive or something, there are still, like, there are day programs that might take advantage of a kiwi or a mango or something, which would again allow that socialization, allow that conversation to occur.
Well, we're really close to our time for wrapping up. As you noted, Lillian, you have to run off, but I want to squeeze in one quick question before you do, and that was, were there any gender differences in terms of how residents reacted to the robots? So one of our participants on the call today has said, I can see my mom loving them, but my dad being like, that's just silly.
It was very interesting that when we talked to a lot of very old people, like they're 101, 102, and 103. I didn't know America has so many centenarians, which is wonderful. And we find in the conversation, the men saw the robot as friends. So we were trying to explain what the robot is, and then one of the men said, so it's just like a friend. I said, yeah, that's right. It's a companion, just like a friend. The women and a lot of these older women see that like a child. So they refer that this is like, like a toddlers. Yeah. So I think we saw, this is very preliminary, like we haven't done the data analysis, but we had collected a lot of the data in those observations and conversation. But we find it a lot of, the men seem to think that they are friends, and the women see the robot as part of their family.
Okay, interesting.
Yeah.
So, well, on that note, I want to say thank you to both of you for taking the time out of your day to really introduce us to these social robots and the potential of technology to really enhance quality of life for folks who are living with dementia. And thanks to all of you who've joined us on the call today. So thank you again, Jim and Lillian. Thanks to everyone who joined us. Wishing all of you a wonderful afternoon.